Hi class. Today we are going to discuss hematology. Our blood consists of platelets, red blood cells and white blood cells. Our platelets are important to help clot. If we have too many platelets, we are at risk for having blood clots, and yet if we do not have enough platelets we can bleed out. Platelets are just so important. Red blood cells help carry oxygen to our body. If we do not have enough red blood cells, we are considered anemic. White blood cells help our body fight infections. If we do not have enough white blood cells, we are at higher risk for infections. If we have too many white blood cells, our body could be presenting too many immature white blood cells. Too many immature white blood cells could be a problem called leukemia. Because the body is producing so many immature white blood cells, the body is not able to produce other cells. So the patients are anemic and thrombocytopenic because of the low platelets. This leads to our discussion on cancer. I am your host today, Mary Mutant. Our normal body cells go through apoptosis. Apoptosis is programmed cell death. In some people this programmed cell death does not occur and people may start to develop unnecessary tumors in their body. There are benign tumors and malignant tumors. Benign tumors are well-defined, slow-growing tumors. They are well-differentiated and do not metastasize. Malignant tumors grow rapidly and are invasive. They are poorly differentiated and can spread distantly or what we call metastasize. We treat cancer with surgery, chemotherapy, and/or radiation. When we administer chemotherapy, the chemicals are as what some patients call poison. They do not know the difference between good cells and bad cells. Because of this, patients develop side effects to chemotherapy. Side effects of chemotherapy can be loss of hair because chemotherapy seems to attack fast-growing cells. Patients will also become anemia, neutropenic, and thrombocytopenic because of the attack on all of the blood cells. These are the same side effects with radiation therapy, except patients may develop a burn in an area being radiated. Thanks for being my listeners in this refrigerator, and hopefully you will take care of yourself by eating right, exercising and not putting any toxins into your body if you can help it. Otherwise, you may look like me.